Kids with autism or signs of autism cry for many reasons, and trying to figure out why they are crying can be tricky. Today's video blog is all about the reasons why kids might be crying and how you can help turn this behavior around. Hi, I'm Dr. Mary Barbera, autism mom, board-certified behavior analyst, and best-selling author. Each week, I provide you with some of my ideas about turning autism and signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. As a board-certified behavior analyst, I've been in many situations with kids crying. Once I went out to do an initial evaluation and the child cried during the entire session. We don't want kids crying. That's never a good thing. I like to use the analogy of me if I were learning to fly a plane. When I start, I have no idea how to fly the plane. I get into the cockpit and there's a zillion levers all around me. And there you are trying to explain the levers and the hundreds or thousands of buttons and levers. And you start talking to me about all these levers and explaining things that's going way over my head. And I might start crying. And if you keep going with the instruction on the levers, I'm sobbing at that point. I'm almost hyperventilating. I don't even want to fly a plane at this point. I'm so overwhelmed. And if you just keep going on and on while I'm crying or sobbing or hyperventilating, I am not learning anything about any of those levers. And so when kids are crying, and professionals and parents are trying to continue with the demands and continue with this whatever situation is going on, it's just not going to work. The child or client who is crying is not going to be learning at the same time. So crying or any kind of problem behavior can be an indication of the child being in some kind of pain. As a registered nurse and a board-certified behavior analyst, I did a vlog a while back about medical issues. I did a few of them. I did one on the importance of ruling out medical issues and how it's impossible, especially if kids are not talking or fairly conversational. I also did a video blog on how to teach children how to indicate they are in pain. And the first step to do that is to teach children to label and receptively identify body parts. So teaching children with autism to indicate they're in pain is a good idea. But like with the analogy of the plane, I'm not in pain. I'm just overwhelmed by the demands and I have very little reinforcement. Things are presented to me that are too technical. And so that kind of crying is probably not pain. That kind of crying is basically my communication. And kids without fully conversational communication often cry because they might even talk, but they don't have the ability to tell you exactly what the problem is. So crying, it can just be communication. Even newborn babies who cry to be fed or cry to have their diapers changed or to be held, it's a reflex, and crying is the first form of communication. But like the plane analogy, if the child is crying, the demands are too high and reinforcement is too low. And that I say a lot because I see a lot of crying and other problem behaviors, and that's all it is. We just have to make reinforcement really high and demands really low and systematically get them higher as we start to fade out reinforcement. But crying is not something that we should just accept as part of autism or a part of being 2 or 3 or 4 or 10. Crying, there are definitely steps you can take. I did a video blog on the tackling problem behaviors, so you can look at that video blog when you're done with this. And the important thing besides learning how to tackle a problem behavior, the first step is always assessment. We need to figure out if it is pain, if it is just overwhelm and lack of communication, if our demands are too high, what is our reinforcement? So we need to really make a good assessment. Then we need to make a plan, and part of that plan is to spend 95% of our time preventing problem behavior, including crying. Finally, check out my video blog on how I use a simple paper calendar system to help keep track of crying and other problem behaviors, and it really could help you start to turn things around. In summary, if you have a child or client who is crying and they have a diagnosis of autism, or maybe signs of autism, or even typically developing children, if you have a child who's crying, whining, or screaming, you don't know how to help them, you want to start with assessment, make a plan, and use my calendar system, which are all outlined in my 3-step guide that you can get for free by downloading right here at marybarbera.com/join. And this free guide is going to help you learn better how to assess, make a plan, and keep easy data to start turning things around today. If you like this video blog, I would love it if you leave me a comment, give me a thumbs up, share the video with others who might benefit, and subscribe to the channel for more videos like this one. And don't forget to download the 3-step guide at marybarbera.com/join, and I'll see you right here next week.